Welcome to the Health Channel, all health, all the time. I'm Kathy Buccio, coming to you from the Baptist Health South Florida studios. Many major risk factors like high blood pressure and obesity increase your chance for something like heart disease or diabetes. And having multiple risk factors is also known as metabolic syndrome, said to be on the rise according to the National Institutes of Health. And joining us today are Doctors Michelle Brewster and Salman Ali, both internal medicine physicians at Baptist Health South Florida. Welcome to the show, and thank you so much for joining us on this topic today.
Thank you for having us.
Okay, so as we get into metabolic syndrome, tell us what it is and what it does and how you help patients with this condition, Dr. Brewster.
So basically, metabolic syndrome is a disorder of energy utilization and storage. What does that mean? So basically, there are 5 different risk factors for it, which we'll get into later on. But the ultimate prevalence of it is that about a quarter of the U.S. adult population is affected by the metabolic syndrome. And it's worse as you get older, and especially in ethnic and racial minority people. So it's definitely something that's prevalent for us to know about.
And that's something we're going to definitely get into. Now, while the NIH says this is on the rise, Dr. Ali, is this something that you're noticing in your practice with your patients?
Yes, well, we see that, all the time. We see up to 20 patients a day, and many of them, have a lot of these characteristics. They include, the obesity, the waist circumference, and when we do our lab tests, when we see our vitals, we see these factors we'll be getting into.
And I'm sure when you tell your patients, okay, you were going to discuss this metabolic syndrome you have, many of them are almost not sure what you're even talking about. So how do you link that to other health conditions? How do you explain that to your patients?
Well, we talk about the end diagnoses, the end effects of this metabolic syndrome, and these are, cardiovascular disease risk, and this includes heart disease and stroke, as well as the risk for diabetes, which affects a lot of our country. And so, that's where we frame it. It's coming from, the metabolic syndrome.
Absolutely. Now, I do want to take a moment to let our viewers know you can call in if you have a question. That number is 855-796-4475. The doctors are standing by, and we'd love to hear from you. Now, in order to have metabolic syndrome, a patient must have 3 of these conditions. So, Dr. Brewster, can you talk about these and why it is that these conditions are so dangerous when you combine them? Okay,
so the first one is obesity and large belly. So specifically with metabolic syndrome, it affects people who have a gut, basically. Okay. And why that is because the fat in this area, in the waistline area, causes insulin resistance. So that's the problem with this illness, is that it can put you at risk for development of diabetes and, of course, heart disease. The second one is increased blood pressure. So definitely blood pressure, if it's greater than 140/85, 130/85, then you're at an increased risk for development of actual high blood pressure that can then lead to heart disease, diabetes. The next one is
high triglycerides.
High triglycerides and the low HDL, which kind of go hand in hand. They're on the cholesterol panel.
Right.
Those are other risk factors that you have to look at, that when you go see your doctor to check to see if you might be at risk for development of the metabolic syndrome. The last one was the increased blood sugar. Which again, of course, will put you at risk for development of actual diabetes,
right,
and its complications of diabetes like heart attack, stroke, and other illnesses.
There's so many complications. Now, I want to spend more time on these conditions, starting with obesity, and an important measurement is the body mass index, or BMI. So can you explain what this is and how it works, Dr. Brewster?
Okay, so with obesity, it's a term that physicians use to basically categorize patients. And there's a chart, there's a calculation, but for our purposes, basically you're underweight if you have a BMI of less than 18.5. You have your normal weight if your BMI is between 18.5 and 24.9. And you're overweight if your BMI is between 25 and 29, and obese if greater than 30.
Okay.
So we want to be in the normal range.
Absolutely, you want to keep it in that normal range. And Dr. Ali, why is it so important, the BMI, when you define obesity?
Well, I think knowing is half the battle, and you can do it yourself. There's a calculation you can do. It's kilograms, and you divide your height squared in meters. But your doctor will calculate it for you, and you'll be able to know where you stand, and they'll help use that number to first identify you, which is half the battle,
right,
and then give you recommendations for the things we're going to talk about on this show.
Now, we hear this term, and I feel like we're hearing it a lot more and more, the obesity epidemic. So when you talk about the obesity epidemic, Can you put it in perspective a little bit? How many people are we actually talking about? Do you see a lot of obese?
Yes, definitely. The CDC states about 93.3 million people are affected by obesity.
93.3?
93.3 million. And that was back in, I think, 2015, 2000, yeah, around that time they had done a study.
So we're seeing it go on the rise.
It's on the rise. It's a prevalent issue that's affecting many Americans, and so we need to address that. That way they won't develop this, do the preventive measures like diet and exercising, so they won't develop the metabolic syndrome.
Another risk, absolutely. Now, another risk factor for metabolic syndrome is blood pressure, and the American Heart Association explains just what blood pressure is and how anyone's numbers can get off track. Let's take a look.
Blood pressure is created when the heart pumps blood through the blood vessels and the blood pushes against the walls of the blood vessels. Blood pressure helps move blood throughout the body, so each part can get oxygen. Healthy arteries, the blood vessels that carry oxygen-rich blood from the heart to the rest of the body, stretch to allow more blood to push through them. How much they stretch depends on how hard the blood pushes against the artery walls. It's important for blood pressure to be within a healthy range to help the arteries stay healthy. Blood pressure can be found using a blood pressure monitor and is recorded as two numbers. The systolic pressure, the upper number, is how much pressure is exerting on the artery walls while the heart is pumping blood. The diastolic pressure, lower number, is how much pressure blood is exerting against the artery walls while the heart is resting between beats. High blood pressure usually doesn't have a cause, and many people don't have symptoms. Sometimes it is even called the silent killer for this reason. There are some risk factors in developing high blood pressure that can't be controlled, like family history, age, gender, and race, whereas there are some that can be controlled, like lack of physical activity and an unhealthy diet. High blood pressure, if not treated, can cause the heart to get bigger because it must work harder to supply the blood the body needs. It can also lead to many serious heart and health conditions. Blood pressure can be controlled by limiting salt intake and eating healthy foods like fruits, vegetables, whole grains, low-fat protein sources, and low-fat dairy products. Finally, always remember to talk with your own medical provider to discuss the best plan of action for your health.
Here's one takeaway from that video, Dr. Ali. There's a connection between blood pressure and metabolic syndrome. So what is that connection?
Well, first let's talk about metabolic syndrome. So the end effects, the end diagnoses that we're trying to prevent when we're talking about this diagnosis or the syndrome is cardiovascular disease and diabetes. Now, for blood pressure, that's the main one for cardiovascular disease. So it's been consistently shown for decades that uncontrolled blood pressure is tied strongly to risk of stroke, risk of heart disease, in that spectrum. So metabolic syndrome, its definition is a blood pressure, like Dr. Brewster mentioned, greater than or equal to 130 over 85. And so that's how it relates, so that you can try and affect the syndrome and then try to prevent its outcomes.
There are other risks, though, that also tie in with cholesterol. So how does the cholesterol play into it? And just to reaffirm, what is cholesterol and where does our cholesterol need to be at?
So without getting too deep in the weeds, cholesterol is a molecule. It's a compound. It's in a class called sterols, and it's important for a couple of things in the body. First off, in the cell membrane, it acts there. It's very important for the structure of the cell, and then also secondly, it is used for as a precursor to many hormones and steroids that the body naturally produces. For example, testosterone, estrogen. Those are eventual outcomes, products from cholesterol.
And with cholesterol, there are quite a few numbers to keep in mind. So, Doctor, can you walk us through the differences between each type of these numbers?
Sure,
and first of all, total cholesterol being the first one.
So this is the easiest number. This is the oldest. You can get this number at a health fair. Of course, you still want to get your lab work checked at your doctor as a fasting check. Generally, ideally you want it to be less than 200. Okay. This is not a number that is in the criteria for metabolic syndrome, but your doctor can use this, together with the other numbers. There are other types of cholesterol. There's LDL, HDL. There are others that aren't really been well studied or relevant. But the LDL is the one you always hear about.
The bad cholesterol.
It's the bad cholesterol. It stands for low density lipoprotein. Your doctor can help you decide what number you should want it under. So you want it low. But for example, for heart disease, you may want it lower than this. But ideally, you want it less than 100. And then for HDL, and that's the good cholesterol.
The good cholesterol.
Yeah, you want it to be higher. So for women and men, it's two different numbers, just the way we've studied it. And for men, it'd be nice to have it greater than 40, and for women, greater than 50.
Greater than 50 for women.
And if it's less, then that actually fits in with the diagnosis of metabolic syndrome.
What about triglycerides?
Triglycerides are they're fatty acids that are in the blood. They are more affected by diet than the others. For example, HDL is affected by a level of physical activity. Exercise can affect it a lot. LDL, for example, is affected by hereditary factors, but triglycerides you can have more of an effect on by diet. So eating less fatty foods, eating less fried foods, for example, that can help affect those, and medication ultimately if you can't.
Okay. Now, some of these conditions can be asymptomatic, but does metabolic syndrome have any symptoms? Dr. Brewster, does it have any symptoms?
Well, the whole thing is that you want to avoid the actual end stage diseases for metabolic syndrome, which are diabetes and heart disease. So yes, definitely there could be symptoms like sometimes you might have increased urination or increased thirst, which would be indicative of maybe something going on. Your sugars are not normal, and you might need to follow up with your primary care physician to get that checked out.
So can you actually have complications from metabolic syndrome?
Absolutely.
Okay.
Some other ones other than the major diabetes and heart disease, you can also have fatty liver, polycystic ovarian syndrome, which is an endocrine disorder that happens to women, and erectile dysfunction for men because of low testosterone.
When you say fatty liver, what does that mean?
So fat will accumulate in the liver. As this area, the
gut area you were talking about,
as that increases, the fat can deposit itself in the liver. And worst case scenario, you can develop what's called non-alcoholic steatohepatitis, and that would require treatment. So you definitely, in order to not have that happen, you have to do diet and exercise.
Okay, thank you for clarifying that. Now we know the numbers. We'll talk about the diagnosis and the prescription coming up next. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question, please call in now using the toll-free number 855-796-4475. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com. You can watch a Health Channel live stream or check out videos from previous episodes. We'll be right back.
This is my kind of happy hour.
This is my kind of fast lane.
This is my kind of personal trainer.
My kind of joyride.
My kind of nightlife.
Whether you're just finding your stride or making the golden years look good, Florida Blue goes beyond health insurance, investing in the health and communities of all Floridians. So you can feel good saying, that's my kind of blue.
This is my kind of blue.
This is my kind of blue.
This is my kind of blue.
Mom, are you okay?
Don't allow your weight to threaten your health or control your future. Talking about your weight is never easy, but is important. Excess weight, or obesity, can cause emotional and physical health risks, such as type 2 diabetes, heart disease, high blood pressure, and sleep apnea. But you can take control. The Your Weight Matters campaign offers free resources and tips to help you measure and understand your weight. Visit yourweightmatters.org to take the Your Weight Matters Challenge. Learn the first steps to improving your health. The free campaign toolkit will prepare you to speak with a healthcare provider about your weight and health. Your weight does matter. Take the challenge and take control today. Visit yourweightmatters.org.
I may look like all the other dogs, But I was born for a purpose, to one day be your companion, your eyes to see the world. I'll be your courage, your friend. With me, you'll find new freedom and hope for a better future. A dog I'm not. I'm a Southeastern guide dog.
Thanks, Coach. Thanks for teaching me about teamwork and leadership.
Thanks for showing me that sports help me stay healthy and do well in school. And thank you for teaching me about concussion.
Letting me know that I should tell you if I think I have a concussion. And how to protect my head and brain. Because one day, I want to be a teacher, an astronaut, scientist, or a coach, just like you.
Thank you for protecting my future.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. With me are Doctors Michelle Brewster and Salman Ali, both internal medicine physicians at Baptist Health South Florida. If you have a question, give us a call. The doctors are standing by. That number is 855-796-4475. Now this hour, we are talking about metabolic syndrome, which is the combination of serious conditions that put someone at greater risk for heart disease and diabetes. Okay, Dr. Ali, so how is it diagnosed? That's what I want to know.
Well, the simple answer is you go to your doctor. You need to make regular follow-ups. If it's even a year, you'll want to do that.
Okay.
The criteria your doctor knows, and we'll tell you now, and you can remember some of these, is, the first one is waist circumference. So most people know their waist circumference because they know what size jeans they wear.
Is this the gut part that Dr. Brewster keeps talking about?
I mean, generally, but it's a little bit higher maybe for the purposes of measuring it. For men, it's greater than 40 inches. It's greater than 35 inches in women. The other tests, some of them you can do at home. Blood pressure, for example, if you have a blood pressure machine, it's a blood pressure greater than or equal to 130 over 85. But the others, you would probably need a doctor, which would be triglycerides greater than 150, the blood glucose fasting greater than 100, or the the HDL less than the numbers we mentioned earlier. And yeah.
I want to go back to the waist circumference. So how do you measure it?
Well, you get a measuring tape, a flexible one, and you would want to put it right above the the upper part of your hip, and wrap it around, not too tight, just snug. And then as you exhale, kind of normally, not fully, that is when you take the measurement.
So I can't suck my stomach in, right?
No, that'll make you have the wrong
That's not going to do anything. Okay. Now, what else can a patient expect in the exam?
So when you go see your physician, you can blood pressure, glucose check, either in the office or even through lab. We just talked about the lab work for the cholesterol and weighing the patient, and the abdominal circumference tape measurement is the total assessment that's done in the physician's office.
So Dr. Brewster, would it be you then as a primary care doctor, the one doing the exams for the metabolic syndrome?
Myself as an internist can do it. Other family physicians can do it. Actually, any physician can do it. A lot of cardiologists, other physicians of different specialists can also do it. If they notice anything that's going on with the lab work, or if they see the patients becoming heavier when they come for visits, they can absolutely suggest it as well.
Do you do them at a general checkup?
Yes. Yes, that's the primary place to get it done, with your primary care doctor as a general checkup.
Okay. Now, let's say the patient's diagnosed. They have been diagnosed with a metabolic syndrome. What happens now?
Okay, so this is perfect. This is where you have an opportunity to intervene. You have an opportunity to start dieting, start exercising. That way you can reduce your risk factors for the development of actual diabetes and heart disease.
Are you ever put on medication for metabolic syndrome?
You absolutely can. There are medications that can be to help with insulin sensitivity. A lot of metformin, Actos, those are medications for diabetes, but they can also help with decreasing insulin resistance. So some people are on that, not for diabetes necessarily, but to help with increasing sensitivity of the insulin.
That's good to know. Now, when it comes to treatment for metabolic syndrome, a doctor might prescribe a healthy diet. And a few weeks ago, we talked to registered dietitian Lucette Talamas about the healthiest diets. Let's take a look.
And since we're talking really more today about the healthiest diets and balanced, and I wanted to look at what's listed as the best overall diets. And this is again according to the US News. The #1 diet is the Mediterranean diet. And I would like to learn a little bit more about each of these from you, Lisette, if you can talk to us about what each of these are.
Sure, we can start going through them briefly. So Mediterranean is a eating pattern. So if you try to go and find the Mediterranean diet, there's not an exact diet. It's more about a pattern and a way of eating and also a lifestyle. So it includes more of your fruits, your veggies, your whole grains, your legumes, nuts and seeds, and less animal products, less dairy. Dairy is still present, but it's just maybe not, those massive pizzas or, just less amounts. Less of the animal fats through, eating less of the animal protein. So you're having more olive oil, for example. So Mediterranean is also a lifestyle, so there's more movement. As we transition to like the DASH diet, it's very similar in the pattern of eating to the Mediterranean, but DASH actually stands for a dietary approach to stop hypertension. Hypertension means high blood pressure. So it's a diet approach to help control your blood pressure. So it focuses also on sodium reduction to 1,500 milligrams per day. So from the 2,300, that's the average American sodium recommendation, down to 1,500 milligrams per day. And last but not least, flexitarian, which is maybe a new term for a lot of people, and it's not that as popular or wide known, but what the word flexitarian means is flexible plus vegetarian. So it doesn't mean you have to commit to being a vegetarian, although we know the benefits of following a plant-based diet that can look differently. So Mediterranean diet can also be a plant-based diet. But if you're following a flexitarian way of eating, you're choosing more plant-based foods and still receiving those health benefits, but you can still have occasional animal products or animal protein.
We're going to continue talking about this, but I do want to take a moment to remind our viewers you can call in if you have a question. That number is 855-796-4475. We'd love to hear from you. Okay, Dr. Brewster, she mentioned Mediterranean diet, she mentioned the DASH diet, and being a flexitarian. They can help with metabolic syndrome, though, correct?
Absolutely. The Mediterranean diet and the DASH diet are particularly good in helping to lower blood pressure, to lower blood sugar levels, to lower weight, and cholesterol levels as well.
And another diet you actually recommend, Dr. Ali, is a high-fiber diet.
Yeah, similarly, it will help with blood pressure, weight loss. It has other effects as well as decreasing the risk for colon cancer, diverticulosis.
Okay, so when we talk about a high-fiber diet, what kind of foods are we talking about in this high-fiber diet?
I like to think of greens. Just think greens. Think your broccolis, your vegetables, your fruits. You want to think about whole grains. As well as even beans, if you like beans.
Absolutely. Okay, if you like beans, that works. Now, in addition to healthy eating, how much exercise should someone do? Because as we said, metabolic syndrome is all about diet and exercise.
Yeah, so what the average recommendation is about 30 minutes a day for about 5 days a week. So that's what's recommended.
150 minutes?
150 minutes.
My math is so good, right?
Excellent.
So you want to be doing some sort of movement or training, I assume?
Yes. If you want to first start off, if you're not a person that normally exercises, you can first start off with a brisk walking for like 30 minutes a day, and that should be good. And then later on, you can increase your intensity.
Now, are the goals of healthy eating and exercising with someone who has a metabolic syndrome mostly to lose weight?
Yeah, definitely. You want to definitely lose weight to decrease your development of the metabolic syndrome and the end problems of cardiovascular disease and diabetes.
Okay. Now, in terms of prevention, there are plenty of steps someone can take to reduce their risk. If someone is overweight, of course, they can aim to lose weight. So, Dr. Ali, can you talk about these risks that we are able to reduce by our own lifestyle choices?
Yeah, I mean, absolutely. These factors we see here to help reduce risk, they all tie into reducing the risk of metabolic syndrome, as well as the risk of developing the end diagnoses. Losing weight very much tied to how big your abdomen will be, makes sense. But as we mentioned, it's shown to decrease your blood pressure. Eating the fruits and veggies, avoiding meat and fatty foods, these will help to decrease and change your cholesterol levels and triglyceride levels. And then the physical activity will play into losing weight.
What about smoking? This is something that obviously is something you probably see in your office and to talk to patients about as well.
Yeah, absolutely. I mean, it's tied in heavily with cardiovascular disease, which, along with metabolic syndrome, that being kind of a, precursor, smoking is a very, if an avoidable thing to do, should be avoided.
Absolutely. Dr. Brewster, is metabolic syndrome reversible? If once you have it, can you not have it?
Yes. With the diet and exercise like we just spoke about, it can be reversed. And that's the great thing about it. You have this window that's been open for you to intervene so you won't develop the cardiovascular disease, you won't develop the diabetes and its all complications of neuropathy and amputation of some people some people have to have amputation of their feet and other things like that, or blindness. So it's wonderful in the sense that you are identified and then you can intervene with diet and exercise to help your situation.
This is something I wanted to know. Is metabolic syndrome something you see more frequently in men or women?
Well, I think it's more prevalent in women, but more ethnic minorities it's more prevalent, specifically Mexicans and the Pima Indians, and then non-Hispanic blacks and non-Hispanic whites.
Okay. Now, in addition to a healthy diet is proper exercise, and we will look at some heart-healthy choices coming up. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question for our doctors, please call in now using the toll-free number 855-796-4475. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com. You can watch a Health Channel live stream or check out videos from previous episodes. We'll be right back.
If you're at risk for type 2 diabetes, it is very important to increase your physical activity. Most people need to start slow. Get motivated by doing something you enjoy. Here are 5 simple steps to get moving. Number 5, exercise while you watch TV. You can do arm or leg lifts. Simple weights or canned goods can be used. Number 4, take the stairs. Start slow. It raises your heartbeat and builds muscle strength. It also works your lungs and waistline. Number 3, go outside. The world is your gym. Explore. Do things you enjoy. Discover a new park, play catch, bike. Spending time outside raises your levels of vitamin D and puts you in a better mood. Number 2, dance around your home. It is a great form of exercise and fun. You can burn 300 calories in just 30 minutes. Number 1, walk. Do it alone or with a friend, anywhere, anytime. It is the ideal low-impact exercise. 30 minutes a day makes a big difference.
Emily is thinking about taking a dietary supplement. She knows she should try to get her vitamins and minerals from the food she eats, but she doesn't always have the chance to eat right. And with more than 50,000 dietary supplements on the market, like a lot of other people, Emily has questions, like how much vitamin A is good for you and how much is too much. If something's natural, doesn't it mean it's safe? Can folic acid prevent birth defects? Should we be taking calcium and vitamin D supplements? Luckily, there's a place everyone can go for answers. It's the website of the Office of Dietary Supplements. We're part of the National Institutes of Health, and since 1995, we've been conducting, funding, and evaluating research that we use to educate the public, giving Emily plenty of information she can share and discuss with her healthcare providers. We're ODS, for what you need to know about dietary supplements.
We develop quality citizens who keep our core, our country, and our communities side by side on the winning side. Not for glory, but for honor. For a code that isn't written or spoken, but lived. It's what we do. It's who we are. It's the battle cry of our fighting spirit. Battles won. See all the battles Marines fight to win at marines.com.
Families come in all sizes and shapes. Sometimes your friends are your family by choice, or sometimes you're just stuck with Uncle Charles. But what we know is that you want to protect the people that are close to you, but the flu can unravel everything. Your flu vaccine protects you and your family. No matter what draws your family together, protect yourself, protect your family. Everyone needs a flu vaccine.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and with me are Doctors Michelle Brewster and Salman Ali, both internal medicine physicians at Baptist Health, South Florida. If you have a question, you still got time to call in. That number is 855-796-4475. Now, while metabolic syndrome is a condition that increases someone's likelihood of heart disease or diabetes, the treatments can boil down to healthy eating and healthy exercise. So one thing to know is you can't really have one without the other. Is that right, Dr. Ali? Is that what you tell your patients?
Yes, absolutely. Losing weight is a big part of metabolic syndrome progression prevention, and studies have consistently shown that having both diet, reduced calorie diet is when put in forth with the exercise, cardiovascular exercise, those are more successful. Those people are more successful than doing them separately.
And there's no magic pill, really. It's the diet and exercise. Mm-hmm. So how do diet and exercise combined help someone with a metabolic syndrome? I mean,
they can both decrease your net caloric intake. That is how many calories you eat per day. Mm-hmm. So eating better food, healthier food, I mean, you may take in less calories versus, doing exercise, you're burning those extra calories. So bringing that number down will help you lose weight, will help you prevent the progression.
So specifically exercise, Dr. Ali, how does that help metabolic syndrome?
Like we've mentioned, it helps with losing weight. But exercise itself also, will when you lose weight, you'll lose the abdominal circumference. Mm-hmm. But also, it's been shown to decrease blood pressure. It's been shown to increase HDL independently, and it also can help other effects like memory, depression, risk, mood. It has other effects too.
Absolutely. Now let's go ahead and look at some general recommendations. And here we see 150 minutes per week, as Dr. Brewster actually mentioned early in their show. So what can that look like for someone per day, Dr. Brewster?
So you can do maybe one day you do dancing for 30 minutes, and maybe the next day you do swimming for 30 minutes, and maybe next day you do running or jogging. So it just depends on what you're into and what you like. Some people who may not have access to like a pool or a gym, they might just run and mm-hmm. jog around the neighborhood, around the block. So you have options.
That absolutely helps, yes. Whether, as you said, even brisk walking.
And brisk walking
absolutely.
As well.
Now, talk to us about the connection between mobility exercises and strengthening exercises.
Okay, so strengthening exercises is like resistant training. So basically, doing push-ups, using free weights like barbells or dumbbells. They can help with muscle strengthening. Mm-hmm. And then also the mobility exercises are like are stretching exercises.
Okay.
So that's helpful to maintain functional flexibility and mobility. So
because the more you move and the more you're flexible, the more things you can do.
Correct.
Okay.
Correct. Yes.
Very nice. Okay, so exercise can be broken down into intensity. And one doctor explains the difference between exercises and how to stay motivated without getting burnt out. Let's take a look.
A 160-pound person walking briskly for an hour can burn as many as 277 calories. Biking for an hour, 292. And running for an hour, 986. But here's the rub about the burn.
We just had too many patients who tried too hard to start with. They became discouraged. They got injured.
Mayo Clinic endocrinologist Dr. Michael Jensen says if you're trying to shed pounds, start by cutting extra unnecessary calories from your diet.
Having an immediate change in eating habits and then gradually increasing your physical activity until you have a comfortable, active lifestyle is probably the best combination.
Step 1, eat a little less. Step 2, start a slow burn. Instead of that brisk hour-long walk, ease up. Even walking at a 2-mile-per-hour pace, you could burn 183 calories in an hour.
Build up your endurance, build up your strength, and then you can add more as time goes on.
In this case, slow and steady can win the race.
We're going to talk more about this, but I do want to take a moment to remind our viewers you can call in if you have a question for the doctors. That number is 855-796-4475. We are standing by, and we'd love to hear from you. Now, when it comes to exercise, we all start somewhere. So how can people know the right intensity and what works for them?
Well, most people have a general idea of what their fitness level is usually, and so they can start from there at their most lowest level. So let's talk about something called the talk test.
Yes, what is the talk test?
So if you can carry on a general conversation, that will kind of be in the middle, telling you can do kind of a moderate level activity. So if you can't sing, if you're doing an activity, say you're walking briskly, you're doing jogging, and you can maybe carry on a conversation, that might be considered moderate. But if you can't sing during that activity, maybe that's going to be in the middle. If you can sing during an activity, that's probably going to be low. And with vigorous activity, you won't be able to really carry on a conversation.
Okay. Now, you want to get a routine going. I think that's so important. I think once you get into a routine, people are more motivated. And you use something called the FIT acronym. So take us through this and what it means, Dr. Ali.
So this is kind of a general framework for an exercise prescription that a doctor may design, but it just organizes that. Frequency is usually measured in days. How many days per week am I doing this activity? It could be 3, it could be 4. Okay. It depends. Intensity being the intensity that we just discussed. Time being blocks. Whatever's convenient. 30 minutes maybe. Or you can break it up throughout the day, and the type are the ones we discussed.
Okay. Now let's take a look at what this can look like for someone who never really exercises. It can be a little overwhelming. So can you walk us through this, Dr. Brewster?
So somebody that's a sedentary person that doesn't exercise, you can first start out slowly. A frequency of 3 days per week is good. Intensity, moderate. Spend maybe 20 to 30 minutes when you're doing it, and the type would be a brisk walking. So you just start slowly, and then later on, after you have a handle on this, you can change. You can add something else to increase your exercise capacity.
And as long as you're moving, right?
As long as you're moving.
That's what you tell your patients.
Yes.
I like that. Okay, and for others who are a little more active, so how do you modify this?
We could do the same thing, maybe increase the days of the week. Instead of from 3 days a week, you can maybe do 4 or 5 days a week. You can also add some other strengthening exercises, mobility exercises like push-ups or a plank hold, squats, things like that.
And when exercising, it can be important to cool down and warm up. And we have a few examples of how someone can warm up and why it can be important. Let's take a look.
We're going to start with our warm-up. Every time you exercise, you should always warm up before you start doing strength exercises. How's everybody feeling?
Great.
You guys ready to go?
Yes. Yep.
Let's start with our warm-up. Here we go. So we're going to start with a march. And so what we're doing is we're warming up the muscles and getting the blood flowing, raising the heart rate just a little bit. So you want to start out slow, and then you can just pick it up as you want to. So we're going to march for 4, 3, 2 more, and get ready. We're going to take it right to a step touch right now. Here we go, step touch. Now when you're doing your warm-up, if you don't do it exactly like I do, that's okay. Because all we're doing is warming up those muscles. So you want to have good posture, abs in, shoulders back, and head up. If you feel it getting a little bit hard, you want to be sure that you continue to breathe. And you want to breathe on the upward movement, the exertion. We've got 2 more. How are you guys doing?
Good.
Your form looks good. Now, if you ever want to practice, and that's good. Now, shake out those shoulders just for a second. The next exercise is the overhead arm raise. You want to have your arms, let me just check everybody out. You want to have your arms in 90-degree angles or a goalpost position. So take it up. And you can use different things when you're doing this. You can use, soup cans, water bottles. I'm using dumbbells. Here we go.
Now here we see that warming up never goes out of style. So these are some great tips, but what about if someone wants to cool down? What are we doing?
Well, cooling down, the benefits will be you'll prevent dizziness from happening. Your heart rate will have a gradual kind of decrease back to normal baseline. Some of the things you can do are, the same activity you were just doing. Say you were briskly walking, running.
Right.
It's just walking slower for 35 minutes and then maybe going to a gentle stroll, after 3 to 5 more minutes. Like if you're on a cycle, doing the same thing.
Now, I want to go back to something in the video that we saw, which is the warming up exercises. But why do we need to warm up? Why is that important?
Warming up will also help prevent, similar, symptoms of, shortness of breath. It'll help you later on recover faster. it can prevent, some of the same symptoms of dizziness.
Right.
Yeah.
So the bottom line is just get out there and start moving, right?
Yes.
Even if it's a walk around the house, at least you're moving. I like that. Now up next, we'll go over final tips to help manage high-risk health conditions. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question, please call in now using the toll-free number 855-796-4475. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com. You can watch a Health Channel live stream or check out videos from previous episodes. Don't go anywhere.
I just need a second.
Is your weight holding you back? Are everyday tasks getting harder and harder to do?
Did you see this? Your cousin's in the hospital from a heart attack.
Really? Health risks associated with excess weight or obesity can be serious. But you can do something about it.
I know you're worried. I found this.
Take the Your Weight Matters Challenge. Visit yourweightmatters.org, where you'll find free resources to help you take control. You can start improving your life right away. Download the free toolkit to prepare you to speak with a healthcare provider about your weight and health. Your weight does matter. Accept the challenge and take charge today. Visit yourweightmatters.org.
Dear humans, I stand here today not for myself, but for every tail wagger, sloppy kisser, and curtain ninja. I stand here for each one of the nearly 4,100 dogs and cats killed in shelters each day, asking you to join our cause and help us make sure every best friend has a chance to meet one of their own. With Best Friends Animal Society leading the charge, and your help, we can save them all.
Addiction is a dark place, but just as each new day breaks, there is light. A light that illuminates the people by your side. Out of the darkness, you are walking with 22 million others struggling with addiction. The cure to darkness is light. The cure to stigma is love. And the cure to disease is treatment. Join us as we walk into the dawn of a new day. Together, we are stronger than addiction. Learn more at chatterproof.org.
If you're like me, when you have the flu, you don't want to go anywhere. And when your kid has it too, life is just awful.
And why should you go anywhere when you'll probably feel better just staying in bed anyway?
That's why Baptist Health's Care on Demand is so crucial. Care right from your bed.
How are you feeling today?
Yeah, we've been sick for a couple days now. I can even get my prescriptions ordered through my care provider after my visit. Hey, hon, could you pick that up at the pharmacy on your way home? And it's care right away, not hours of driving in the car and then sitting in a waiting room. Because when I have the flu, there's only one thing I feel like doing.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. With me are Doctors Michelle Brewster and Salman Ali, both internal medicine physicians at Baptist Health South Florida. I want to remind our viewers to call if you have a question and you still have time. That number is 855-796-4475. And we have a caller on the line. We have Jacqueline from Fort Lauderdale. Hi, Jacqueline, are you with us?
Yes, I am.
Hi, Jacqueline. Thank you so much for calling in. If you have a question for the doctors, go ahead.
Yes, I have metabolic syndrome, but in addition, I have neurocardiogenic syncope. And, you know, I've had this diagnosis like for 9 years, and I've gone twice by ambulance. The first time out of Denny's restaurant with a blood pressure of 40/20, and the second time from collapsed in church, and that was 76/40. I get like an aura before I have that, so I pretty much know now when my head feels a little funny to stay in the chair. So I haven't hit the floor in 8 years. But because I have both of these conditions, I exercise. I do a sit-down elliptical for at least 30 minutes a day. I've had multiple heart problems, including 2 heart attacks. And I have leaking valves. In other words, I do the best I can. I also have muscular dystrophy, the non-alcoholic fatty liver. My blood sugars, A1C, run like 5.9. So I was wondering, is there a contrast between these two? Any recommendations? I know you're on the program for the metabolic syndrome, but because I have that and the other, and I'm watching a program, that's why I called in.
Thank you, Jacqueline.
Well, thank you, Jacqueline, for calling. It's you have a different symptoms going on and conditions going on, so it's a little bit more of a complicated situation for you. As far as I think a link between the two, to my knowledge, there's no link between metabolic syndrome and neurocardiogenic syncope. But it's good to hear that you are doing some exercises to help with with the metabolic syndrome, and that you make accommodations for your situation with the neurocardiogenic syncope, taking that into consideration when you exercise. But definitely, I think dieting will help your situation as well, and you might be a candidate for the medications like Actos or metformin to help with decreased insulin resistance.
Yeah,
About you,
I
Dr.
think
Ali?
obviously you know a lot about your medical history, and I think knowing is half the battle. You know, it sounds like you have regular follow-up. You are, going to your doctor. You know your diagnoses. You know a lot about them. So knowing that part of it, and then having